This research showed that dentists used many more prescriptions for conditions that are associated with mercury toxicity, 7.5 times the number of prescriptions to control neurological conditions, and significantly more drugs for respiratory and coronary diseases than non-dentists. The article, The Health Status of Dentists Exposed to Mercury from Silver Amalgam Tooth Restorations, published in the International Journal of Statistics in Medical Research, October 2012, by Tom Duplinsky et al. Dentists had increased skin hyperpigmentation, respiratory disorders, irregular pulse, hand tremors, spasms of the upper extremities, neuropsych symptoms, tachycardia, painful chewing, thyroid enlargement, fears, and difficulty in writing. The article, Symptoms of Intoxication in Dentists Associated with Exposure to Low Levels of Mercury, published in Industrial Health in 2011 by Nagab M. et al. Neurological issues such as memory loss, concentration issues, fatigue, and sleep disturbances related to working with mercury amalgam are discussed in these works. Is dental amalgam safe for humans? The opinion of the Scientific Committee of the European Commission, published in the Journal of Occupational Medicine and Toxicology, December 2011, by Mutter J. et al. Neurological Symptoms Among Dental Assistants, a cross-sectional study, published in the Journal of Occupational Medicine and Toxicology, December 2008, by Moen B.E. et al. Pregnant dental staff, quote, suffered higher odds of developing spontaneous abortion and preeclampsia and giving birth to babies smaller for gestational age, end quote. The article, Mercury-Induced Oxidative Stress May Adversely Affect Pregnancy Outcome Among Dental Staff, a Cohort Study, published in the International Journal of Occupational and Environmental Medicine, July 2018, by El Badri A. et al. Results from 13,906 dentists suggest, quote, a positive association between mercury exposure and tremor, end quote. The article, Occupational Mercury Exposure in Association with Prevalence of Multiple Sclerosis and Tremor Among U.S. Dentists, published in the Journal of the American Dental Association, 2015, by Anglin J. et al. Researcher who is an expert on risk assessment concludes that dentist occupational exposure should also be considered as justification for reduced amalgam use. The article, Inhalation of Mercury-Contaminated Particulate Matter by Dentists, an Overlooked Occupational Risk, published in Human and Ecological Risk Assessment, 2003, by Richardson G.M. Authors state, quote, symptoms from the central nervous system are among the health problems that most often are attributed to mercury exposure in dentists and dental nurses working with amalgam. Uncharacteristic symptoms of chronic low-level mercury vapor exposure, including weakness, fatigue, and anorexia, have been observed in numerous studies of dental personnel. The article, Mercury Exposure and Health Impacts in Dental Personnel, published in Environmental Research, July 2018, by Aseth J. et al. Researchers of this study linked the polymorphism CPOX4, or coproporphyrinogen oxidase exon 4, to decreased visual motor speed and indicators of depression in dental professionals. The article, The Association Between a Genetic Polymorphism of coproporphyrinogen oxidase, Dental Mercury Exposure, and Neurobehavioral Response in Humans, published in Neurotoxicology and Teratology, 2006, by Echeverria D., Woods J.S. et al. Researchers conclude their review, quote, reveals a significant occurrence of neurological and sensory symptoms in dental workers occupationally exposed to chronic low levels of metallic mercury, end quote. The article, Neurotoxic Effects of Mercury Exposure in Dental Personnel, published in Basic and Clinical Pharmacology and Toxicology, May 2019, by Borklin G. et al.